Hi, my name is Scott Urquhart. I'm the chair of the Metabolic and Endocrine Disease Summit. I'm here in Orlando, Florida in October, and we're celebrating our 7th year and 14th meeting with the highest attendance we've ever had. So we're quite pleased with how well we've been able to educate our primary care providers and internal medicine providers throughout the nation. One of the lectures I gave was on adrenal insufficiency, and into the discussions on adrenal insufficiency and also into Cushing's syndrome. Many of the referrals that we receive in our endocrine practice, unfortunately, is for a diagnosis called adrenal fatigue. Now, adrenal fatigue is not a known diagnosis. It's not recognized by the Endocrine Society or the American Association of Clinical Endocrinologists. With that being said, it's still not a reason to be dismissive to patients or to merely discount them and tell them that it doesn't exist, because what they really have are symptoms that are associated with another condition or perhaps another disease. What's missed in these cases is that the patients spend a lot of time doing some research on their own, on Google, for example, and lots of good information can be found. However, it's a highway for a lot of misinformation. As a result of this misinformation, they believe they have something called adrenal fatigue, and they come in looking for ways in which they can treat it. And some of the complaints, of course, are nonspecific, and they don't really line up to what we would call adrenal insufficiency, which is the true diagnosis in which adrenal glands underproduce cortisol. In these patients, there's a belief that the condition that's occurring is that the high stress demands of life, the busy work, the busy family life, puts undue stress on the adrenals, and they can't keep up producing enough cortisol. And as a result, this is where the belief or the myth is coming from. So the things that these patients present with are kind of nonspecific. So obviously the one is fatigue, body aches, excessive sleepiness, can't sleep well at night, for example, cravings for carbohydrates, feeling sluggish in the afternoon. So many nonspecific symptoms where if someone really had true adrenal insufficiency, such as Addison's disease, and the cortisol was low, they would have symptoms of course, some fatigue, but they would have loss of appetite, weight loss, potentially low blood sugars, low blood pressure, a condition that needs to be treated seriously and not missed in the diagnosis. So what we now face in our endocrine practice and many practices in primary care settings is how do we sort through these patients? And yes, they can be screened appropriately. If these patients have a concern about adrenal fatigue, for example, looking into such things as depression, fibromyalgia, anxiety disorder, obstructive sleep apnea, and then looking into a family history and personal history of autoimmune conditions, those being Hashimoto's thyroiditis or Graves' disease, type 1 diabetes, celiac disease, along those lines of having other autoimmune conditions that would increase one's risk for having true adrenal insufficiency or Addison's disease, which we do have ways in working that out by checking morning cortisol levels at 8 a.m. for simple screen, or a more specific test called an ACTH stimulation test would definitely yield the result we need to know about true adrenal insufficiency. So all this diagnosis is challenging for many practices. Try not to discount the patient. Making sure the proper workup is important, because what's being found on the internet is supplements that can be bought, and some of these supplements are upwards of $200 per month, and it's very expensive. They are not tested by the FDA to prevent, treat, cure any disease, so they're not founded in science, and as a result, the patients take these, and some of these could be adrenal gland extracts, if you will, which could cause harm to the patients. But in doing so, we're missing the primary diagnosis or other diagnosis, again, depression, anxiety, fibromyalgia, sleep apnea, etc., that may be going on, and these patients will continue to suffer on the misdiagnosis. So it's very important that we focus on this and be very astute in our knowledge and make sure that we're educating patients and not being dismissive. So I hope this finds some resources for you that you can use within your practice, and looking forward to hopefully seeing you sometime here at Meds in the future. Thank you.